Anthony Davis is expected to be out indefinitely with a right foot injury. Another strange situation where he almost seemed to injure his foot in midair after it contacted Nikola Jokic. Welcome back, everybody. I'm Dr. Brian Sutterer, and if it's your first time here and you enjoy learning about anatomy and mechanisms of different sports injuries, then consider subscribing to stay up to date with all my future videos and support the channel. I was among many people shocked this afternoon to find out that Davis is going to be out indefinitely, at least a month, with a right foot injury that he sustained here against the Denver Nuggets. And upon first review of this replay, it really looks like the only abnormal thing here is how Davis hits Nikola Jokic's leg with his right foot. We see a little bit of twist go through the foot there, and of course we found out that he has a foot injury. As he swings his foot through here, you see a slight amount of inversion with his ankle pointed down and the foot in some plantar flexion, but this isn't really anything that I would have initially thought of as even causing an ankle sprain, let alone a significant enough foot injury. So it's just another unfortunate one of these sort of fluke types of injuries that Davis has suffered, kind of similar to what happened with him last year. This was that play last year where Davis came down on that same foot, seemingly looked like he had just sprained or rolled his right ankle. Then, of course, we found out that he was going to miss an extended amount of time with, again, a right midfoot sprain, kind of similar to what we're hearing with this most recent injury. The reporting so far has not been very detailed beyond the timeline, but if you look at sort of the sequence of how this unfolded, I think it clues us into at least that the injury is to some sort of a ligament or a tendon. Of course, last night, Davis left the game and was initially listed out today with just foot soreness. So presumably, they would have done an x-ray to look for a fracture, at least initially. And so it gives you some clue that I don't think we're dealing with a fracture, because I think they would have found that out last night and we would have gotten that update before this morning. With our biodigital anatomy tool here, what I've done is shown you all the different ligaments of the foot, because I want you to understand how many exactly there are. Ligaments connect bones to bones and tendons connect muscle to bones. So all of the different bones that we have through our midfoot, there's countless little ligaments that help to secure all those bones together. And the midfoot is a really complex joint because we have this arch structure to the foot if we look straight on at it. But then, of course, as we look to this side, we also have our more traditional arch. So there's actually this two arch system through the midfoot, and it's particularly susceptible to any sort of twisting or kind of forefoot movements that occur more so through kind of this region of the foot. So if you imagine sort of grabbing someone's heel, grabbing the front of their toes, and then sort of twisting out or in, those are oftentimes the kind of motions that we see causing some type of midfoot or just foot sprain. To be honest, I don't really see much of that here on this contact with Jokic. It looks like most of the bending, most of the energy goes through his ankle rather than his midfoot. And so I sort of hope that the injury occurred maybe on one of these steps before the actual contact to Jokic. And frankly, it would probably be more likely that it occurred on one of these steps before, where he's kind of coming through at an angle. There's a little bit of, especially on this step, you can see his foot is pointed out a little bit. He's trying to push off in this direction. And this is kind of a move that sometimes we see cause these midfoot sprains, and especially like football players. And so I wonder if the injury occurred more on that first step or when he goes to push off right here, because frankly, I don't see how this little knock to Jokic is something that could cause enough trauma to result in a month plus of an absence. Common things being common when we hear about foot sprains or foot injuries, I wonder about that Liz Frank ligament, similar to likely what Davis was dealing with last year. Of course, that Liz Frank ligament connects the medial cuneiform bone to the base of the second metatarsal, because there's no direct connection between the first metatarsal and that second one like there is through the rest of these foot bones. So the Liz Frank ligament is really important for kind of maintaining that continuity, that strength through the midfoot, and is one of the more common midfoot injuries that we see in athletes. But remember, all those other ligaments that I showed, you can have sprains of those ligaments. There's a lot of ligaments on the underside of the foot. So it's a complex area, and I doubt we'll hear specifically unless we find out that it is in fact a Liz Frank sprain. Sometimes those can be surgical, but it depends on if there's any instability between the bones of the foot. If it's a low-grade sprain, it's often a period of being on crutches to unload the foot, protected in a boot, and then some gradual rehab. There are, of course, a lot of other possibilities here, though, that could have similar timeframes to injuries to different tendons in the foot, and like I said, any of those other numerous ligaments throughout the foot. I think the bigger thing here that this is, of course, going to unfortunately do is make a lot of people just continue this conversation that Anthony Davis is made of glass, that he's injury prone, etc. And I hate that discussion because it implies that he's at fault. It almost implies that the player, when we say they're injury prone, is like not working hard or they're not working out as much as they should to prevent injuries. But sometimes players just have variances in their tissues that make their soft tissues, like their ligaments, their muscles, not quite as resilient to different loads. Sometimes I think this is one of the big things with Davis is just because of how long and tall he is, there's more force that's applied to all of his joints because of having these longer lever arms, especially talking about like finger injuries. Players who have longer limbs have longer lever arms, which impart more force at the joints. And it's possible that Davis just has some variations in his soft tissues that make these little incidental knocks that don't seem like much true structural injuries to his tissue. So even if there is some component of that, it doesn't mean that he's like at fault or should be blamed for being injury prone. Remember, there's variation in all these players. The same way that LeBron's tissues seem to have this unbelievable level of durability over the years, there are players on the other end of the spectrum where the tissue might not be as resilient or might not just have the genetic makeup to sustain different loads, different forces applied through them, like potentially what we saw here with Davis. As frustrating as this is for Lakers fans, I guarantee this is even more frustrating for Davis to yet have another one of these kind of, again, fluke appearing injuries that is going to result in an extended absence. If we get more specifics about the exact injury for Davis, then I'll be sure and do an updated video, but I wanted to give you just my initial thoughts looking at the play, knowing Davis's injury history, and then hopefully tamper some of the discussions that are going to just throw a lot of blame on Davis, because again, even if a player has tissue that maybe is more prone to forces causing injury, that doesn't mean that the player should be blamed, because that's not something they can control. It's not something they can necessarily train to improve in all situations. And so as frustrated as you are as a fan, maybe you think about what Davis is going through, because again, it's hard to really blame him and say that he's at fault and that this is something that's exactly in his control. Thank you as always for watching. Hope this was educational for you. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.